Assalamu alaikum and welcome everyone to another episode of The Doc is In. Imagine being able to take a deep breath again, something many of us take for granted. But what if breathing itself became a battle for survival? Today, we're diving into the fascinating and life-saving world of lung transplantation, exploring groundbreaking advances happening right here in the UAE. I'm Dr. Yazan Aljabery, a cardiac surgeon at Cleveland Clinic Abu Dhabi, and joining me today are two exceptional experts shaping the lung care in the UAE. First, Dr. Usman Ahmad, the Department Chair of Thoracic Surgery here at Cleveland Clinic Abu Dhabi and the Director of the Lung Transplant Program. Assalamu alaikum. Hi, Dr. Usman.
Thank you, Dr. Yazan. Thank you for having us. It's a pleasure. Very important topic that we will talk about today.
Thank you. It's a pleasure for having you today. And on the left side, we have Dr. Fadi Ahmad, a pulmonologist and a consultant intensivist here at Cleveland Clinic Abu Dhabi and the medical director of the lung transplant program here with us. Thank you, Dr. Fadi, for making time for that.
Thank you, Dr. Yazan. And again, hopefully we'll give you a lot of information and help a lot of patients here today.
Inshallah. I know you guys have a very busy schedule, but this is extremely important for both physicians and for the general public to raise awareness, to make people know exactly what we do on a daily basis here at Cleveland Clinic Abu Dhabi and our achievements, not just on a national, but on an international level.
Absolutely.
So let's dive directly into it and talk about the medical conditions commonly leading patients to need a lung transplant. Dr. Fadi, maybe you can answer that.
For sure. Again, thank you again for having us today. And really, when you talk about lung transplant, we talk about a big topic, right? So we talk about the transplant itself, but also we talk about the patients. And exactly the first question you asked, that who needs transplant? So when we talk about lung diseases in general, we're talking about a wide spectrum of lung disease.
Sure.
But when we talk about lung transplant specifically, then we talk about patients who have what we call end-stage lung disease, for which their clinical condition has deteriorated despite the medical or surgical treatment. And in simple terminology, the basics, of lung diseases for which transplant is being performed usually is what we call COPD or emphysema, or what we call it smoking-related diseases. So if we look worldwide, what's the most common cause for lung transplantation? The primary disease for which transplant is being done is COPD or emphysema, which is a medical condition from usually long-standing history. The lung get damaged. The other very common condition for which transplant is being done also right now, and mainly actually in North America, is what we call lung fibrosis. It's when the lung becomes stiff and fibrosed and the lung tissue loses its function. Then we have a lot of other medical conditions. We have what we call bronchiectatic disease, a medical condition very commonly we see in young age, what we call cystic fibrosis. We have a condition where the pressure in the heart or in the lungs goes high up, called pulmonary hypertension. So these are very advanced end-stage lung disease that sometimes, despite the appropriate medical treatment in the right time and the right effort in the right center, despite doing all that, unfortunately, the clinical conditions continue to get worse, and the only treatment option left after we exhaust all the medical and surgical treatment would be lung transplant.
That's an extremely important point. So we always start with medical management, try to exhaust that, then we move to surgical management, and then our last destination is usually the lung transplant.
And maybe I can go one step before that, prevention, right? When I told you the most common condition for which we do transplant is COPD, and that's come from smoking. So we always aim from prevention, then treatment, then appropriate management, and then when we fail, this is where we go and proceed with the transplant.
Okay, just to be clear, what do you think the most common cause for patients leading to end-stage lung disease? Is it more congenital? Do you see more congenital or like lung cystic fibrosis and all of this? Or is it more the smoking and these acquired habits?
I think it's both. It depends on the age also, right? So the older population, the older age, we're talking about COPD and emphysema and ILD, interstitial lung disease. The youngs in the 20s, usually either they're genetic congenital disorders or genetic disease like cystic fibrosis. And pulmonary hypertension also is an entity that really happens a lot of time at the young age. So age, depending on that disease, is related sometimes to the age of the patient.
Okay, and when we talk about these patients, these end-stage lung diseases, how does it impact the quality of life of these patients?
Absolutely, and this is where you started your discussion, right?
Yeah.
Imagine not able to take a deep breath, right? So for granted, we walk, we stand, we climb stairs, we play sport, and you do your normal daily activity without even thinking of, the process of taking a deep breath.
True.
Those patients cannot sometimes walk for 50 meters, 10 meters, put their clothes on, just take a shower, go into the bathroom, right? So all of these that sometimes we take it for granted, you lose that capacity and functionality because of this advanced end-stage lung disease, and your oxygen concentrator become your friend. So you also start to be afraid. I can't go there because I'm afraid I will lose the battery on the charging on my oxygen concentrator. I will run out of oxygen. So all of these things adds up, and what we take for granted is actually a blessing for those patients when they unfortunately end with end-stage lung disease.
That's
Let
correct.
me just add something here, a point that both of you brought up, and is a very important thing for patients to think about and families to think about when they're seeking care for a complex heart or lung problem. And that is that you want to seek care, you want to go to a place for your care where they can take care of everything around that disease, that they have a team in place that can work with you to prevent the disease, to provide the best medical treatment for the disease in the early phases of the disease, provide the surgeries that are necessary to take care of the disease, and then, if necessary, transplant and after transplant care. And as we will talk about later, we're in a very unique setup and a very unique position where we can take care of all of this now for both heart and lung in the UAE at Cleveland Clinic Abu Dhabi.
And provide the full spectrum, as you just
Absolutely.
mentioned. That's extremely important. And that's a topic we're going to elaborate more on, multidisciplinary teams and how we work very tight together here at Cleveland Clinic Abu Dhabi. Something to be really proud of.
Absolutely.
So now when we shift to the topic itself, who is the ideal candidate for a lung transplantation?
Again, another challenging question, but we touched base about it. The whole concept when we need to do transplant, as I said, we should exactly make sure that we have the right diagnosis, we have done the right treatment, and despite that, the patient has progressed. Now, those patients will be sick, but at the same time, they're able to go and do a major surgery called lung transplantation. So the ideal, you're talking about age, for example. We're talking about what we call the body mass index, or the weight and the height of the patients. We talk about somebody with still able to have what we call functional status, right? Able to walk, to stand, to move. Somebody who's unfortunately bedbound 24/7, not moving, not walking. We need to optimize these things. So in simple description of those patients, we need to have, first of all, somebody who's willing to accept the concept and understand that, unfortunately, despite all the medical surgical treatment, now we need to work you up to list you, because the workup is not listing, right? So when you refer somebody for lung transplant, we have to do a lot of work together as a team, as a multidisciplinary team, in order to assess your disease, then assess the other part of your body, right? If I have an end-stage lung disease, but at the same time, I have some other major contraindication to go for lung transplant, we won't be able to do that. So ideally, it's a patient who has end-stage lung disease. We get him referred to us. He's able to do basic functional activity, being able to walk, stand, and move, and do the basic stuff. And then we will put together the other aspects of heart, lung, kidney, liver, the rest of, body organs in order to work you up to be listed.
Okay, so just to make sure that everybody gets that, so we start to see the full evaluation of the patient, do the proper workup, and then the listing happens.
Absolutely.
And that's, of course, something that you guys both, the surgical and the medical part, have to come together in order to agree on that patient and list him for a transplant.
Absolutely. So in simpler terms, the people who benefit the most from solid organ transplant, whether it's heart transplant, lung transplant, liver or kidney transplant, are patients in whom that one organ is failing, but everything else is in good shape. So that then they can have a major operation and recover from that operation well with the new organ and go back to normal life. So the reason to do all this extensive testing before listing is to make sure that all the other organs are in good shape so that the patient can safely have a liver or a heart or a lung transplant and then go back to their family and homes and live a normal life.
A very good point, a very good and valid point. But let me ask you directly, is there any specific challenges in the patient population that you see here in the UAE compared to the ones that you used to see in the US?
That's a very good question. In today's time, every region is different.
Sure.
Every region has its unique needs, and we're finding that out as our program is growing. What we learned from our experience in the United States is mostly applicable in the UAE, but there are certain specific demands and needs of the region. The patients here generally come at a more advanced stage. They come to us sicker because they have not been referred at an appropriate time, or they have not had access to this type of care before. So their evaluation takes a little bit longer. We sometimes have to spend some time rehabilitating them to make them appropriate and fit for transplantation. The types of diseases, particularly the types of infections that are present in this part of the world, are different from the Europe or North America. And those are all specific details that we take into consideration when we look at someone to decide if this person will benefit from a lung transplant, how to do the lung transplant, should we do one lung or both lungs, and how do we care for them after the transplant. So we look at all of these questions in great detail to set up that treatment plan.
Okay, and the access. What do you think of the access and the medical? Let's talk about insurance generally. Who are the patients who are actually eligible even to come and approach us?
So, that's a very important question. We're here to save lives.
Sure.
Our job is to do everything we can to help every human being possible. We are very fortunate, very privileged that the government of this country, the government of UAE, and our leadership in Abu Dhabi and Cleveland Clinic Abu Dhabi is very supportive that if someone needs care for a life-threatening heart or lung problem, we can generally get support, find support to take care of them.
Nice.
And our transplant programs in particular are very unique in that sense that we have the ability to take care of patients, usually regardless of their financial burden. Because of that, we don't say no to life-saving therapies. We take care of everyone who can get to us, who can come to us in time. So when someone approaches us, our program, our multidisciplinary team, we do their evaluation. Typically, we admit them to the hospital to look at their heart, lungs, all the other organs. If they are a good candidate, if we think they will benefit from the transplant, then Dr. Fadi and his team looks at them medically. We list them after discussion with the whole team, and then we wait for the right organ and the right match to happen.
Wow, that's something really that all of us need to appreciate. And as you mentioned, we are in a very unique environment. We all are very thankful for that, I guess. And this is an opportunity for everyone here in the country to make use of it and get and benefit from that access and special privileges that we have here.
And this is when we mentioned we're talking about a team, right? So it's a multidisciplinary team approach. So this is where there's the medical part, surgical part, right? We have what we call social worker part, right? So the psychosocial aspect, part of this all gets integrated into part of the assessment and part of the access. So right, so if you're able to come to Cleveland Clinic Abu Dhabi, you're able to be assessed by the medical part, the surgical part, but also there's the social part that we also get involved about it. So this is the whole idea when you mentioned about access, presence, the concept that this program is here locally in Abu Dhabi in a center that's able to provide you a world-class care for lung transplantation few miles away from your home, and you have all the team present around you to help you, to support you. If you have challenges from financial, psychosocial, insurance, we would like our team to help you and support you for that in order to provide you with the care you deserve and need and save your life.
And we are able to provide all of this in Abu Dhabi at Cleveland Clinic, Abu Dhabi, without any problems, without any issues. And that takes us to the very big next step, which is something that we see on a daily basis and something that's probably not known for everyone. It's the multidisciplinary team approach that we have here, whether it's in the heart and the lungs. We have a very unique setting that provides us with, I think, one of a very very high standard multidisciplinary team approach. What can you tell us about that, especially here in the setting of Cleveland?
Thank you, Yazan. That's the very important point for patients and physicians to understand. What we do at the Cleveland Clinic is that if you walk through the front doors of the hospital, there is nothing that we cannot take care of. If there is a disease that we take care of, everything around management of that disease can be done under one roof by one team who are dedicated to take care of that heart problem or that lung problem or that transplant problem. And that is really the key to our success. We have expertise from every part of the world, teams that work together, and we rely on each other to take care of our patients well. And what we promise is that we will take care of them like our family members. And I cannot sometimes guarantee them what the surgery will look like, what the recovery will look like. But what I can guarantee people is that we will take care of them like our family members, regardless of what the needs of their disease are.
Amazing.
What people think it's a sign of weakness to have a multidisciplinary team approach. Actually, it's a strength. Right?
Definitely.
So this is where
Yeah.
that strength comes from. When we sit and talk and discuss somebody with an end-stage lung disease, you're talking about a pulmonologist, a surgeon. You also have subspecialized pulmonologists, right? As I said in the beginning. So you have to make sure that you tackled every aspect from the primary lung disease, every aspect from the other medical condition, every aspect from the social aspect, the physical therapy performance, the pharmacotherapy performance. So this team approach is a sign of strength, that we look at every angle that a patient needs, rather than saying it's a one-man decision, a one-man show. Science has developed, right? There's a lot of subspecialty in every kind of medical field. And this is where this team sit together with more than 10, 15 people in a room just to discuss the patient. And the perfect example just yesterday, a patient who was referred to us for assessment for lung transplant. And going back to the point where we started, right? Did we exhaust all the medical therapy available for the patient? So we presented the patient of what we call the multidisciplinary team interstitial lung disease meeting. We have a radiologist, a rheumatologist, the pulmonologist. We have the surgeon in there, and we said, let's go back and step behind and say, right now, do we still can offer the patient treatment before saying that you need to be committed for a life-changing process, right?
Definitely.
And guess what was the answer? Yes, we have option. Let's work on that treatment. At the same time, we can work upon listing and we can meet in the middle. So what a lot of other centers do not have access to this kind of multidisciplinary team approach. Actually, this is our standard approach in order to bring the right appropriate decision by a group of physicians who are expert in their fields. But when those ideas meet each other, at the end, the one who gets the most benefit is the patient.
Definitely. And let me emphasize on this point specifically, which is it is never a single doctor's decision. And that's what many patients worry about, that they go to a doctor and he immediately says, okay, let's go for surgery. And this is something that we hear very often. They end up going to another hospital, seeing another doctor, and then a third doctor and a fourth opinion. And they get inconsistent answers at the end, and they get confused, and they lose sometimes their trust in the system.
I agree.
So this is something that we have here that I haven't seen in many places where I worked before. And that's the multidisciplinary team leads to a consensus. It's never a single doctor's decision. It's having all the doctors on the same table at the same time, discussing the patient's need and prioritizing the patient's benefit at the end.
When you talk about a complex medical or surgical condition, that's the standard of care right now.
Yeah.
When you talk about some basic management, that's different. When we reach very advanced, highly leveled, complex medical surgical opinions matter, decisions matter, and the patient wants to feel comfortable that the decision that was taken is the right decision for me by the expert who really are able to trust and at the same time offer me the treatment.
Definitely.
Another interesting way to look at this is that when we are dealing with difficult decisions about patient's disease, we're sitting in a room as you're part of some of those teams, you're part of the teams. Everyone in that room has 10 to 15 years of experience in taking care of that disease. So collectively, we're talking about a century of experience on which we rely to base our decision to try to do the best thing for the patients.
And very diverse experience.
Absolutely.
Yeah, we're talking about the Western, national, international. So this really adds a lot of value to the whole conversation and to the decision making. And that reflects directly, I would say, on the outcomes.
Absolutely.
If we can please talk about our outcomes, how many lung transplants have we done until now, and where do we place ourselves on the international level?
So there's a great question. There's several answers that I want to elaborate upon. The first is that we are in a very unique situation. Geographically, we're somewhat in the center of the world.
Sure.
And medically, also, we are finding ourselves in a position where we are seeing patients from very distant areas, other continents, who do not have access to care, either because it's unaffordable or they just cannot get to that center in North America or Europe in time. And now we are seeing patients from Asia, from Europe, from South America, and even complex patients from North America who are seeking complex care and coming to the UAE, to Cleveland Clinic Abu Dhabi for these specialized services, surgeries, and medical care. Our lung transplant program, because of that, has become a center of international interest.
MashaAllah, alhamdulillah.
We are, alhamdulillah, taking care of sick patients from all over the world. Patients who are either they don't have access to lung transplant in their own countries, or they're trying to get to a lung transplant center, but they cannot get to it. And the UAE has this culture of tolerance and openness that also translates into medical care. And medical tourism is now becoming a very popular thing. Patients have easy access to get to us. We have a system in place where they can access us, have a phone call, have a video call while they're still in their home country at home. If we think we can help them, they can get on a plane and come here, and then we take care of them moving forward. With all that in place, in a very short time of 2.5 years, we have done close to 60 lung transplants. Wow. These are 60 lives that have been changed. These are 60 families that are together. And the impact of this is just tremendous. A lot of these patients have gone back to their home countries where they came from. A lot of them have gotten married, gone back to universities to complete their education and their degrees, and are doing their jobs again and become productive members of society. And it's just heartwarming to be able to be a part of something this great. Because of the excellent medical and surgical care in the multidisciplinary fashion that we offer at Cleveland Clinic Abu Dhabi, we're very fortunate that our results are outstanding and are comparative or better than most programs around the world. We don't say no to most problems. We're able to do very complex surgeries that other newer programs may not be able to, or may not be willing to take on very high-risk patients. So in medical terms, let me give you an example that when someone's lung has completely failed, they're placed on a bypass machine, what we call vena-venous ECMO or VV ECMO. Generally, these patients will seek transplant at very busy programs, very high-volume programs in Europe or North America. But we're able to take care of these patients here. We've had several instances of Emirati patients, of patients who traveled around the world to get to us with ECMO support, and we've taken care of them. We've had several patients who've been evaluated in Europe or North America and have been turned down for transplant because of complexity of the disease, and we've been able to take care of them with our multidisciplinary teams, and now they're back in their home countries and leading normal lives. There's nothing special about me or Fadi or you. What is special is that we work together and we put our best efforts in the patient's best interest. I think that is what makes us unique, and that is what helps us our patients the most.
Well said, well said. For a very young program, like we're talking about 2.5 years, that's a very young program. Doing 60 lung transplants, alhamdulillah, with such great outcomes, this speaks a lot. Not just, as you said, of a single person, but probably for the whole team that works behind it. Dr. Fadi, maybe you can also talk from your side.
Yeah, for sure. I think Usman, summarized a lot of things. It's the effort, the team. When we talk about them post-transplant, it's a different journey, right? We touched a bit about the pre-transplant workup and assessment. The post-transplant journey is also completely long process also that takes place at different levels, like the intensive care unit, our cardiac ICU team, our physical therapy team, our respiratory therapist. So all of these teams are integrated in our round, in the post-operative day. Then you go to the acute floor where there's a different phase from different level of rehab, teaching, the pharmacy. So I think the point in here that I always add also to what Usman mentioned, sometimes when we get into the day-to-day life of being doctors, sometimes we miss the humanistic aspect of it. And this is where the touch we take care of a lot of patients, just even when you do the surgical patients but sometimes we miss that part when they come later on, you see them with their family, with their kids. Those patients, just like any other patient at Cleveland Clinic Abu Dhabi, they become part of our family. So they send us their wedding pictures. They send us their graduation pictures. They actually invited us to their,
Wedding.
to their daughter wedding, in there. So you see that part where, again, for the younger generation who's into the medical field, how things are all moving to computerized AI. That human aspect is still part of our job as doctors. And this is where, when we get touched and engaged with those patients, and for sometimes we lose those patients right after 5 or 10 or post-transplant. I can tell you, the family will still thank you and tell you, you gave my father life for 3 years, for 5 years. He saw my son, graduating from the university. He saw, me, getting married. So all those humanistic aspects that we would like to continue to do, that's what makes us unique. That's what makes those patients are part of our family. They're not just a number or a patient that's coming through our door. They're patients that we want to serve, help, and become the big family, because at the same time, they are ambassadors, right? When they go out and they see what we have done for them, this is where all those other patients hear about us, know about us, and then we get the benefit of their care being transferred to a world-class center that we provide the care for them.
And I think that's very nicely said and well put, because for us as physicians and our busy schedules, everyday work, we get drifted sometimes and forget that everything that we do impacting those patients' lives, it's not just the patient himself, but the whole surrounding,
Absolutely.
the whole ecosystem. When he goes back, bringing him back to life, bringing him back as a productive member in the community.
Exactly.
That makes a huge impact on him, on his family, and on the community then afterwards.
Imagine being a teacher, not able to stand, speak, because of, for end-stage lung disease. Your life, you're losing your job. You get a transplant, and now you're going back to work, standing up. And this is a true story. He's back to work. He's able to do his daily lessons to his kids, to his, in the school. So all of these small stories, again, you started with the right thing. We take it for granted, but when you get sick, you forget about it. But now you have a chance for a second life.
True.
And when we do the transplant, we want to go and be a functional person, serve the community, and be an ambassador. And these are the 3 kind of main aspects that we have been able to achieve so far.
Life after a lung transplant. Let's talk about truths and myths. So what does it really look like in the first phase after the transplant? And what are the myths that people think about usually and ask that you see very commonly in your clinics?
I think that's an excellent question. And we always, at Cleveland Clinic Abu Dhabi, transparent.
Yeah.
There is nothing always granted 100%, right? So the transparency part of what to expect, what do we do, and what happened after that is part of the assessment. So we tell them about the journey, pre, during, and post, the complications that you may face. Now, in a well-established, high-level quality center, that a lot of challenges that can happen during or after always being doable to be managed. And that's when we tell them about, for example, simply the number of medication you're going to take after transplant, so you don't get surprised about it. And simple message to the patients. When we do the transplant in there's always going to be challenges that can be overcome. There's advancement in science, in medical technology, in medical therapy that we can challenge. The myth that's still there, that the outcome and survival of lung transplant is poor and it's slow, and then people will lose their life after a month or 2 or 6 or a year. Yes, it's true. You can lose your life, without even having a medical problem, right? From any medical condition. But the truth right now, with the development and with the advancements of therapy, what we call surveillance, making sure that your graft is working well, the way we follow up those patients, the 1-year survival at Cleveland Clinic Abu Dhabi, or even in the world, talking about more than 90 to 94 to 95%. So you're expected to have a normal life within that year. The 3 years and 5 years survival has dramatically improved to exceed 60 to 65% at 5 years. And we're talking about a solid organ transplant that 10 years ago, those numbers were barely in the 80s and in the 50s and the 30s. So yes, we're still in the process of progressing and improvement, but the myth that this is a surgery that even if you do it, the outcome and survival is poor is not true. So we want to make sure that we deliver the message that the 1 year, which is a good marker of survival, the 3 years, which is another marker, and the 5 years is now beyond the standard of of what we used to call poor outcome or low outcome, or losing the graft or the lung function shortly. Now, at the same time, there's medication, there's complication that can happen, but again, in the right center, in the right people that's keeping an eye on you. This is where we work together to get this successful outcome. And so far, our data speaks on itself about our success.
Maybe you can add to that, especially for patients that don't have any other choice, I think. Yeah, this is their last choice, their last resort. They have already been suffering for a long time, exhausted all medical opportunities. You are their last cornerstone. How do you approach those patients? And is there usually a challenge in convincing those patients to get such a big surgery like a lung transplant and the myths around it and the survival rates?
You know, as humans, we think that we are we control our destinies and we control our lives. And it's very difficult for us to give up that control. When you're on your feet and you have a job and a family and you're living your life, you are the king of your day. When you get sick, particularly such an advanced condition that may need a lung transplant where you cannot get out of bed or not have enough oxygen to go to the bathroom or take a shower, and you're admitted in a hospital surrounded by strangers where you have given the control of your life to people you've never met before, it is a very difficult problem. It is a very difficult situation to deal with mentally. The biggest hurdle and also the biggest opportunity and privilege for us is trust. What we tell our patients is that trust us to be your advocates. Consider us your family members. We are here to take care of you. Our job is not to do more medical treatments or more surgeries. Our job is to help you get better. And we will help you get better however we can, whether it's better medical treatment, more medications, less medications, surgeries, transplant, whatever it may be. As a team and as a hospital, we take that trust very seriously. When I walk into a room and talk to a patient, or we walk into a room and talk to a patient who may need a lung transplant, we are not trying to convince them to get a lung transplant. Our job is to explain what it means to have a lung transplant, what will life look like after a lung transplant, what are the risks, what are the benefits. There are many times where we've walked into a room and told Baba that, you're like my grandfather or my father, and I don't want to do a lung transplant for you because I think it is the wrong thing to do. And we should explore other avenues.
Because you think they're too high risk?
Because I think the risk is,
fit?
Because I think I will not be able to help them with the surgery.
Okay.
Because I think it is the wrong thing to do.
Excellent.
We have no problem in being completely transparent because my job is not to do a lung transplant. My job is to help that person and get them back to their family. And that is the level of transparency and the truth that all physicians we think we work with, and we hold ourselves to that standard. At the same time, there are people who obviously will benefit from these complex surgeries, heart transplant or lung transplant or both together, which we've also done here in Cleveland Clinic Abu Dhabi, where we've taken heart and lungs together and transplanted them. And if we think that someone is very sick, but we can safely do the operation, and we think that they will get better, then we don't hold anything back. And we give them that information, and as long as they trust us to take care of them and they agree to move forward, then our efforts night and day are on their behalf and for them to help them get better, walk out of the hospital, go back to their families.
Maybe you can briefly walk us through the technologies, the advancements that have happened in this field, and what can we offer at Cleveland Clinic Abu Dhabi that other places in the world probably don't have?
So the field of solid organ transplantation has come a long way. In particular for heart and lung transplant, there are certain areas that have had advancements in the last few years. Now we are doing our surgeries in a way where we connect the patient to a special heart and lung bypass machine, but we've made changes in how we run that machine. So we used to do a lot of these lung transplants on what we call cardiopulmonary bypass, but we don't do that anymore because that adds some extra risks. So now we try to do these transplants either without using cardiopulmonary bypass or use an intermediate strategy, or what we call ECMO, which decreases the risk during this operation, decreases the chances of getting blood transfusions, and the recovery is a bit faster while still protecting the new lungs. In addition to that, at Cleveland Clinic Abu Dhabi, we have some very unique um, ways of doing things because of the environment that we're in. So our matching ability between the organ and the donor, organ and the recipient, is much better because of our geographic advantages. So the distances between the donor and the recipient, the physical distance is much smaller in this country. So we're actually able to do the matching much better. We're able to look at the donor lungs ahead of time and improve their quality by treating them with antibiotics, bronchoscopies, procedures, and scans, and then take those lungs and transplant them. And that has given us a significantly improved outcome in terms of recovery, survival, and all of those things. We are looking at incorporating newer technologies that help us maintain the quality of the organs while they're taken out of the donor and they're still waiting, whether in an aeroplane or in an ambulance or in a room, waiting to be transplanted into the recipient. So we have these newer technologies that we're in the process of incorporating, and this is being done in conjunction with the National Organ Procurement Organization, Hayat, which is very important to talk about here. Their efforts have dramatically changed the landscape of organ donation in this country, and I think we should talk about that also.
Definitely.
But in combination, in collaboration with them, we're establishing these organ preservation technologies, and the next step will be organ rehabilitation. That if we have lungs available, but they're not perfect, they need a little bit of time or they need a special treatment, we can actually take those lungs, put them in a special machine for a few hours, improve the quality of those lungs, and then do the transplant operation, which can result in more availability of lungs, so we can help more patients, and it can improve the results after the surgery.
Excellent, excellent. And these technologies are available already. They're not mythical, they're not theoretical, they're not experimental.
Absolutely.
These are things that we do on a daily basis.
Absolutely.
And we have already procured also international lungs. We've flown, we've sent groups and teams to other countries just to harvest those organs, bring them in the best shape possible, and transplant them in another patient. And these were success stories.
Very successful stories. So because of the uniqueness of our program and the openness to not just take patients from other countries and take care of them, but because of this, we've been able to build relationships with other countries where we can also get access to organs and donors from those countries. So now, and that results in everyone benefiting. Our patients, their patients, everyone has more access to organs and transplants. Because even today, if you look around the world, for people who need lung transplant, there are more people dying every day waiting for organs because we don't have enough organs available around the world. So every organ counts. Every organ can be a life saved, a family altered, a society altered. So we try our best to use every possible organ that we think is good that will help someone, whether it's in the UAE, whether it's in a surrounding country that we have a relationship with. We try to get those organs to try to save a life.
And that wouldn't have been possible without the support and the directions and the guidance of the Hayat program, which you briefly mentioned. Maybe you can elaborate on that more. How did they change the map in the previous few years?
So Hayat has been instrumental, and I think it is very important to recognize their efforts in establishing a national organ donation program where people can get registered and are encouraged to get registered to donate any possible organ. Excuse me. None of this would be possible without obviously the leadership of the country and the direction that they've set the country in. So this is a remarkable time in the UAE for organ transplantation. It is also very important to note that this is all being done ethically and above the law. And the international ethical standards are applicable, maintained. There's all over the world, there's concerns around organ trafficking and other such issues, but that is very, very tightly monitored and regulated in the UAE, which is fantastic. So because of Hayat's efforts, now we have access to organs. We try to use all of them. We still have patients waiting. And I think it is very important for all of us to consider this ultimate gift of life.
Definitely. And maybe Dr. Fadi, what message would you have for the general population and for people to actually register in those organ donation programs like Hayat, for example, which is a very important thing and could be saving. Sometimes we think about foreign people's lives. It could end up saving some family members' lives.
Exactly. So, again, remember some conditions where we need solid organ transplant, like the lung and the heart, you have to unfortunately get it from what we call diseased donor. There's no living related. We know in the kidney and the liver there has been still active transplant being performed for a brother giving to his father or a sister to her mother, because this is what we call living related for the liver or the kidney. When it happens to the lung and the heart, that cannot happen. So when you have your dad or your mother or any family member that has an end-stage lung disease, the scenario that you can only save their life when there's a family that unfortunately has lost their family member and now they're in a medical condition, what we call brain dead, or unable to unfortunately survive the catastrophic event that they had with a brain death. And those people during this hard time, they're giving the time to think of donating the organs of their beloved one to see them living in somebody else. And I can tell you, many of the patients who end having lung or heart or even kidney or liver transplant from a deceased donor, the next day their family members will go and say, I'm going to be an organ donor.
Yes.
Because when you see the wait you have been waiting for that call to come to say, we have a matching donor for you, please come to the hospital to do the transplant tomorrow. You could be waiting for a week, a month, or 6 months. Imagine what could happen during this time period. So when they see their beloved one receiving the transplant, the next day morning say, you know what, we're going to register, we're going to save lives, because now we understand the concept of what to do to save a life when you're in need for an organ. So without what Hayat, without what the country have been doing, we as a physician doing solid organ transplant would not have been successful in performing that. So you need to have a system that's able to provide that organ donation procurement to be done. And I think over the years, Hayat has done what countries needs 20 to 30 to 40 years to be done. It's being done here in a short period of time with a success story, with patients getting the treatment they need to get locally, home, where they live, with all the family members being around. I focus a lot on the social aspect. We all work internationally. Imagine trying to walk to the bathroom with the 3 liters of oxygen. Then imagine you need to fly for 20 hours on a plane to be abroad in a country with no family around you sometimes, or it could be one family members, new environment, new people, with an oxygen concentrator, going to do work, stay there for 6 months or a year post-transplant. Now this is done locally where you live with the same quality, standard, outcome, performance than everybody's around you in the place where you have lived, and you go back to where you have been living for the last 20, 30, 40 years and go to the same supermarket or mall that you have been doing that. So it's all happening locally where you live, with people around you, surrounding you, with the same quality.
It's life transforming, definitely. Very nicely said. And maybe just a last message from Dr. Usman. Ahmed, to most patients who are hanging by a thread now. Let's say they have exhausted their options, they are there, they're desperate, and they don't know what to do.
I would say that we're here. Use us. This is a world-class facility with standard of care, cutting-edge treatments available in open surgeries, big operations, minimally invasive surgeries, complex heart surgeries, lung surgeries, including heart transplant and lung transplant. Allow us to take care of you early, because delay can lead to changes that we cannot reverse, and that may take you out of the window where we can offer anything such as a transplant to you. Allow us to help you. Trust us to help you. We're here to take care of the country. We're here to take care of everyone in this region. It is our privilege to be here, and we are fully committed and dedicated to do that. Our promise is, as I said, that we will leave no stone unturned in taking care of you and your family members, and it is our privilege that you trust us in letting us do that.
Thanks for that message. It's a very strong message, and thanks for that promise. It's not something easy to give, but certainly something that we deliver. Thanks for having me today. It was a huge pleasure of having both of you today here. Such well-experienced colleagues of mine that I am proud to work with every day and come here with a smile and leave with a smile, because we know at the end, every life matters. Patient care is our top priority. And here at Cleveland Clinic Abu Dhabi, this is our mission day and night, no matter what time, what case, what's behind that. It is patient focused, and that's what we do best. Thank you guys for being here today.
Thank you very much.
Thank you so much.
Pleasure to be here.
Thank you.